So hello everyone and welcome back to my YouTube channel, and today's video is a continuation of the series that we just started, Simplest Road to Crack GPAT, and today is part 4, which will encompass the pharmaceutics subject, and it is subdivided into different pharmacy subjects like associated with pharmaceutics like physical pharmacy, industrial pharmacy and NDDS. So firstly, we have a very major portion, a core portion that we need to prioritize, and that is your industrial pharmacy. So there you have tablets, capsules, parenterals, and aerosols. Everything of these four chapters must be at the tip of your tongue, whether it be the method of preparation, whether it be the excipients, whether it be the evaluation parameters, or other things associated. And you have to refer Martin. That's the best book. You know why? Because the statements directly pop up into your examinations from Martin from these subjects. Next up to prioritize is suspension and emulsions. So suspension and emulsions are biphasic dosage form, and you have to study them from Subramaniam. Everything like regarding the emulsion theories, when we speak about suspension, so you need to know about the degree of flocculation, sedimentation volume, various rules, Stokes law, Bancroft's law, everything. The difference between emulsion, the evaluation test for emulsion and suspensions. You should be well versed with these chapters. Next up is physical pharmacy, wherein you need to know rheology, which is a flow of fluids, and micromeritics, which is a particle size. So you need to know everything about the methods used, the instruments used, the particle size that is measured by various other instruments. Rheology mein you need to know the types of flow, how those flows, the examples of fluids that exhibit those flow. So that is essential. Next up, you have solubility and chemical kinetics. So solubility mein methods of enhancing solubilities. In chemical kinetics, the difference between the first order, zero order, and the pseudo zero order or second order. So you need to know the difference between the half lives, the units, and the shelf lives, because the first order, zero order, and second order, they have various other units of half lives or various formulas for shelf life, so you need to know the formulas as well. Next up on priority will be posology, because the formulas for posology pop up straight into exams, either in the form of numericals or in the form of case study. Like they'll tell you that there's a child who's 2 years old, and or something like that. They might give you the months. So you should know that if it is months, you have to apply the Fried's formula. If it's up to 12 year, you have to apply Young's formula. If it's again in specifically if the age is given in months, only in months, not in years, so it will be Dilling's formula. If it's surface area, if the weight is given, so the on the basis of weight, it will be Clark's formula, Katzil's formula for body surface area. So similarly, you need to know the different types of dosing parameters. Prescription, the parts of prescription, what does the RX symbolize, what are the different terminologies like ad libitum, QID, BID, twice a day, 4 times a day, stat, only when required, SOS, etc. So you need to know the different Latin words and their meanings. Also the thing of conversion, fluid drachm, fluid ounce, minims, grains, teaspoon, tablespoon, wine glassful, that is important. Complexation and states of matter. So in the states of matter, you basically have solid, liquid, and gaseous, and the different Lane-Claude's effect, various laws like Boyle's law, Charles' law, Avogadro's law. That is important. And complexations are the types of complexes: inorganic, metallic, chelate. Then you have clatrates, you have cyclodextrin, monomolecular, etc. So from this complexation, do not leave the types of complexes. There is direct question. Next up, you need to know is the suppositories. So in suppositories, formula of displacement value and the types of bases. Same with semisolids, the types of bases and method of preparation: by levigation, by trituration, by chemical, like iodine ointment, you prepare it by a chemical method. So there are different methodologies for preparing different kind of ointments. Like Whitefield ointment is a mixture of benzoic acid and salicylic acid. So you need to know the different ointment bases as well. Next up we have is incompatibilities. So incompatibilities are basically of three types: physical, chemical, and therapeutic. So you need to know the what are the different physical incompatibilities, like immiscibility, insolubility, precipitation, and liquefaction. In pharmaceutical calculation, you need to know the different methods of pharmaceutical calculations, like alligation, isotonicity method. So these are the methods that have to come in the exam. You will expect a question on the same, so you cannot leave this. Next up you have is NDDS. So NDDS may you basically have important micro encapsulation, the methods, the well, like air suspension is for solids. You have co-service and phase separation, which is for solids and liquids both. So you need to know the particle size as well of that particular method. Next up, you have liposomes, niosomes, dendrimers, resealed erythrocytes, and so many other novel drug delivery systems. So just have a briefing like what are the different polymers used. Suppose if it's controlled release, so what are the methods like matrix, reservoir, and in matrix and reservoir again, what are the different methods of release of the drug? What are the correct suitable candidates? Like if you're preparing a sustained dosage form, so the half-life of the product has to be between 2 to 10 hours. Also, there are certain dose. What is the solubility? All these parameters for the suitable candidate are to be known for the designing a controlled release dosage form. The next step that we have is pH and buffers. So in pH of buffers, the formula of Henderson-Hasselbalch is to be studied very well, and you need to know the formula very, very well. And in pH, if possible, try to study the pH values of citrate, acetate, and borate buffers and phosphates, because sometimes the values are asked in exams. And the last one we have is pre-formulation studies. So in pre-formulation studies, you basically have different pre-formulation parameters like flow of powders, angle of repose, tap density, bulk density, true volume. Then you have the different crystalline, amorphous, what is the difference between them. Then you have the polymorphs like enantiotropic, monotrophic. So that is very oftenly asked in pre-formulation studies. So you cannot miss the pre-formulation studies part. So in all, on this page, if I see, you have everything in detail to be studied from tablets, capsules, parenterals, and aerosols. You cannot leave them. Suppositories, semi-solids, you can study the bases and the displacement value formula. Similarly, for prescription posology, you need to know the formulas. You need to know the which part signifies what. If it's signature, it is direction to the patient. If it's subscription, it is it is it is instructions to the pharmacist. So that is to be known to you all. Rheology, micromagnetic solubility, complexation, surface tension, these are all chapters that are basics, so you can move back to your 12th or 11th and take refer those notes as well, because units of surface tension, such a small question, the value of surface tension of water at 25 degree, such easy kind of questions are asked. Dielectric constants, what will be the change in the polarity, etc. So you need to be well versed with these chapters. So this is what is important if I speak about from NDDS, the different matrix, different release formulas and all. So that's all for today's video. I hope you all did enjoy it, and if you have any doubts and queries, feel free to drop them in the comment section. I'll be more than happy to answer it. Thank you so much, everybody.